Hi, my name is Sarah Kennedy. I'm a student nurse from the University of Manitoba. I'm calling to speak with Dr. George in regards to patient Linda Clark in room 123. I'm calling because Linda Clark's status has changed and she is presenting with a wound infection as evidenced by a small amount of purulent drainage, raised temperature, white blood cell count of 12.7, as well as a positive test result for bacterial infection as taken from a swab test. So Linda Clark was admitted on October 18th with delayed wound healing from a wound following a fall. So the wound is on her lateral left thigh. So the patient has a history of diabetes mellitus for the past 9 years, COPD for the past 15 years, as she is a 10-year ex-smoker, peripheral artery disease with intermittent claudication for the past 7 years. She is on scheduled diabetes medications, as well as has an order for 15 to 30 milligrams morphine to be given orally. So those will take place before her dressing changes for pain, and the dressing changes occur 3 times a day. Recent lab values include coagulative studies on October 18th, CBC chemistry on October 18th revealing white blood cell count at 12.7, albumin at 27, and hemoglobin at 109, as well as a swab test which came back positive for a bacterial infection. So the advanced care plan of Linda Clark is resuscitation or CPR. So the most recent vital signs of Linda Clark show a temperature of 37.9 degrees Celsius, which is an increase from her temperature prior to that at 37.1 degrees Celsius. Her blood pressure on her right arm shows 107/52. Her pulse on her right radial is 102 and is +1 or +1 for force and is also regular. She has a respiratory rate of 18 and oxygen saturation at 95% on room air. So assessment of the wound itself shows a dark red interior to the wound bed with a brighter red on the outside, surrounded by 1 centimeter margin of black necrosis and hypergranulation. Again, there is that small amount of purulent drainage, as well as a moderate amount of serosanguinous drainage coming from the wound. So I'm calling to see if you would like Lisa Clark to begin antibiotic therapy.